Hello, my name is Anthony Rebay. I am a second year master's student in the athletic training program at Texas Lutheran University, and today I will be talking about modes of absorption of drugs. And the first one I'm going to talk about is enteral, which means oral. These drugs are swallowed or ingested into the body. So they go into the stomach, they start dissolving, and then they move into the lower GI tract, small intestines, large intestine. But before it goes to the small intestine, some of it gets taken up by the liver. This is called the first pass effect. So the drug goes into the liver and starts being metabolized by the liver enzymes. So this affects how much of the active drug will actually be taken into the blood and then be sent to the rest of the body. That's important because it determines how much of a drug we will take. So that's why you take 2 to 4 of ibuprofen or 2 Aleve. And it's also important because it kind of gives us more information about drugs and the amount of time a drug spends in the stomach's pH, and gastric motility into the small intestine. Those determine the amount of a drug that's absorbed. Which brings up the next thought is slowing down gastric emptying increases absorption of a drug into the small intestine. So the next topic is the parenteral or injection drugs. So these would be insulin, vaccines, IVs of those sorts. And so insulin is a subcutaneous injection, and this is you take it and you inject it into like your stomach or your abdomen region, and these have a slow dispersion and absorption into the bloodstream. It takes some time. Yes, it's in a small amount. It's not a large amount due to irritation of the area, but because it's small enough, it will enter the body faster than a large amount, but it's still going pretty slow. It's very slow. The other kind for a vaccine would be a skeletal muscle injection. And so whenever you get like a flu shot, they usually do it in the deltoid of your arm, and these are faster than the subcutaneous. There's a large proximity of blood vessels in the muscles, and so the drug is taken up by those blood vessels and sent to the rest of the body. And the last one of the injection or the parenteral are the IVs, and these have an immediate response. They are directly in the blood. They inject it into you, so this would be like your painkillers, your morphine, and they would be these have an immediate response because they avoid the liver. They avoid the first pass effect, and that's really important because this gives us a clear understanding of this is how much we can inject, and you get a very fast response, and has you can do a long-term drug therapy. The next type of mode is inhalation. So this would be like your allergy medication. There are some painkillers you can do it this way, antibiotics, and so these are like a gas or a mist. And so albuterol is one of the most common ones for asthma, and they're very fast absorbing, and they're fast absorbing because of the large surface area of the lungs and the rich blood supply, because the alveoli have so many capillaries covering them that it doesn't affect the oxygen transportation across it because they're so small and because there's a large surface area. The next one is topical, and the topical drugs are ointments, skin patches, some of them are powders, and this is important because since you're putting it on the skin, it has to be lipid soluble for the skin to absorb it. Yes, it can be water soluble, but it'll take longer for the skin to absorb it because it has to go through the epidermis. And that's really important because there are some NSAIDs out there that are topical, and it would take longer for them to get into the body. Many of the drugs that are administered are mainly to care for skin ailments of that matter. You put hydrocortisone cream on your skin because of an poison ivy incident. So these wouldn't really be used to enter the body per se, but they're more for like localized on the skin. This information is important for daily patient care because this information can help understand how quickly a drug can go through a mode of absorption. So if I ingest an NSAID, it may take an hour, 2 hours before I finally feel the effects. Whereas if I were to, let's say, inhale the NSAID, it could be so fast acting that I could feel it in 5, 10, 20 minutes. And also, it's kind of important because it's beneficial to an athletic trainer to know if what your patients are ingesting or how fast they're reacting to a drug that you're giving them or they're taking on their own. Thank you very much.